Well, good afternoon, colleagues and friends. I'm very happy to welcome you to the Munk School of Global Affairs and Public Policy. My name is Peter Lowen. I'm the Associate Director of Global Engagement at the Munk School, and I'm very pleased to be joined today by our esteemed partners at Ipsos and at Cevipof at Sciences Po for this event on democratic politics in the COVID-19 pandemic. If you're like me, you're wondering where democratic politics are going in the next few years. Is it the case that COVID is going to continue to be at the top of the agenda, or are other issues going to make their way back in? Are incumbent politicians and governments going to be given the wide leeway they've been given to undertake emergency and other widespread actions, or are they going to be constrained by voters in doing that? And do things really look the same around the world, or is it just that we know about a few big countries that are doing things and we don't know about how democratic politics are playing themselves out in other places? We've got a great group of people joining us today to help us answer that. I'm joined by my colleagues, Daryl Bricker, who is the CEO of Ipsos Public Affairs, based here in Toronto, and proud to say also a senior fellow at the Munk School. I'm joined by Vin Arsenault, who's a professor at Cevipof at Sciences Po, for my money, one of the great political scientists in the world. And we're joined by Henri Willard, who is the deputy CEO of the Ipsos Group and the chairman of Ipsos in France. I'll just say something about this partnership, which animates this event, and that is that Ipsos has a remarkable practice across many things, but their global advisor data practice is regularly surveying citizens in dozens of countries around the world. And we're very happy to be partnered with them at the Munk School as a repository for that data and as an intellectual partner in some of our own events. But much more than that, the global advisor data is used by corporations and other key government and non-profit decision makers around the world to figure out the direction that things are going. And when we're studying politics, there's perhaps nothing more important than knowing the views of citizens. So I'm very happy to welcome Henri and Daryl today to really bring to bear on this conversation about democratic politics in the era of COVID, what citizens are thinking about things and how citizens are behaving. Before I turn things over to Henri, I want to do two things. The first is that I do want to, as is our proper custom, acknowledge that the land in which the University of Toronto is situated is the traditional home of the Seneca, of the Huron-Wendat, and more recently the Mississaugas of the Credit. And we're very fortunate, and we should be and are thankful for the opportunity to work here on Turtle Island. And we look forward to doing that increasingly in a spirit of reconciliation as best we can and should. The second thing I wanted to say is that we do want to engage you in this conversation with us. So I'd encourage you to use the Q&A function, which is available. So put questions into the Q&A chat as the talk goes on, and we'll build those in near the second half of our hour together. Okay, that's enough. That's enough from me. I do want to turn things over to Vin if he wants to say anything from Cevipof, and if not, we'll turn it over to Henri to get us kicked off on what Ipsos is seeing around the world.
I just want to say thank you, Peter, for that very kind, overly generous introduction. And I just want to say that here at Cevipof, we're very excited about working with Munk School. And I'm very much looking forward to today's session. So thank you.
Thank you very much, Vin. I'll turn it over to you, Henri.
Thank you very much. First off, you're welcome in organizing this event. And I want to say that whether it's in Canada with Munk School or in Paris with Sciences Po and Cevipof, we value a lot the partnership and working with academic institutions where we can engage with very senior researchers and also take a step back and look at the perspective and deeper perspective about the data we produce and the analysis we can then jointly share. And it's a time to pause and think more deeply about what happens. And I will try to share today precisely a certain number of elements in perspective with the question of democratic politics and the COVID pandemics. And I think it's quite an interesting event that, of course, we had in France a very specialized, special circumstance, is that the pandemic really developed and caused a very drastic measure in the country with the lockdown, just at the time of precisely of an election, which was the local election in March 2020. So I just wanted to say something which may seem very practical, but had a real impact, is just the fact to organize an election in times of COVID. what else in democracy do we value but elections? So elections, when actually people have lockdown, cannot do campaigns, cannot do meetings. That's really a tough question. And in France, the local election was scheduled on the 15th of March. And just to give you, for those who live overseas or not familiar with the French situation, the first run of the election was scheduled on March 15th, 2020. And the first lockdown started on March 16th, 2020. So we were just at the beginning of the tidal wave of hospitalization and big concern in the country about this. And we had an interesting situation that there was a long gap between the first run of the local election on 15th of March and the second run only happened on the 28th of June 2020. So a month later, which is very unusual and not what happens usually in elections. They either are 1 week difference or 2 weeks difference. And there still, is some debate whether this first run should or should not have taken place. And bear with us, in the context of all the unexpected things which happened at the time, that was, of course, very difficult. And it's very easy to look back and say we should have done this or we should have done that. So this is not the point. The point is that it was really navigating and trying to have an election in the very first and strong phase of the epidemic storm. Decisions were made based on some deliberation, made by a scientific council, which was just, established a few weeks before the election day, and was giving scientific advices to the government. And finally, decisions were made to lift some measures or to impose some measures on the country. So there were, before the first vote, some recommendations about social distancing, about the fact you should clean up very carefully, the voting places, etc. But in the end, what really happened is that there was a lower turnout. The turnout of voters in 2020, the number of people who did not vote, in that election was 55.4 people. So a majority of voters, registered voters, did not vote at that election. And it was way higher. It was almost 20% of the voters, compared to 20% more of the voters who did not vote compared to 2014. So a really big rise in the non-voters proportion in the country. And in a survey which actually Ipsos conducted in partnership with Cevipof, we interviewed the non-voters on why they didn't go to vote and when they made their decision. And what's interesting is that among the non-voters, about 1/4, 26%, decided before the beginning of the epidemic that they would not vote anyway. Then 17%, they decided that they would not vote between the start of the epidemic and the president address on March the 12th, 2020. So the president addressed the nation just before the lockdown, just before the election, announcing a certain number of decisions, in particular about restriction, about kids going to school. But then two addresses happened, one by the president on March the 12th, and on March the 13th by the prime minister. And this is where, basically more than 1/2 of the non-voters made up their decision. After the president address, about 1/4, and after the prime minister's address the next day, the day after, on the March 13th. So it gives you an idea on how difficult it was to actually consider even elections in the face of this crisis. And after that, we asked people also what were the reasons for non-voting. We made this survey, which I just mentioned, partnership with Cevipof, just after the first run. And the main reason mentioned by people was, of course, coronavirus for 57% of the people we did interview. A quarter of them basically were saying, well, we know the outcome of the election, we know what will happen, so it's not really a useful vote for me to go. And then a little less than 20% saying that anyway, I would not go to vote because it would not make any impact for my own life. So there was a clear and very understandable issues on just to organize and implement election in the context of COVID. But interestingly, this turnout for probably different reasons, but was also lower the next year in 2021, when we had some departmental and regional elections, where there was also a lower turnout than before. So we can ask what combination of democratic disenchantment there could be behind this lower turnout, but also some lasting effect or some ongoing fears about contamination, being close to other people, handling their pencil, and in the end voting in the booth. The second thing I wanted to mention was about the rating of the government action along the way during the pandemic. And of course, there were high and lows. Something which remained pretty positive and pretty good was the support from the government given for firms and business and the economy. It was rated satisfactory. There was a low part in September 20 or 44%, a higher one year later, September 21 with 61%. And this had ups and downs according to the decisions and the moments in the crisis, but this remained pretty high. On the dealing with the coronavirus, there was more pronounced variations. There was a rather positive feeling at the beginning with 55% supporting the action of the government. It went to a low point in September 20 with 35, and then went up again around 50% in the more recent period. And now, right now, we have a rather stable appreciation. About 50% of people who have a positive appreciation on how the government dealt with the epidemic. The rating of the vaccination campaign, in turn, had a sharp rise at the beginning of the year in January. The favorability about this campaign was about 36%, and it went high as the campaign developed and progressed, high to more than 63% at the beginning of September 2021. So seeing that the campaign was actually effective, and that actually in the end, a rather high proportion of French, about 85%, are now fully vaccinated. So, however, if we see that some of the effects of this turmoil and this variation in opinion support for the different aspects of the policy in the middle of the COVID seems to be now behind us, we cannot rule out that positive and negative effects, and probably some negative, have a more long-lasting effect than we think. Now, more recently, and that's the third and last point I wanted to raise about the popularity of the government, of the president, of the prime minister, and the situation right now in the country, is that, as Darrell will probably illustrate as well with the comparison with other countries, we are back to a situation where the popularity, the support for the president and the government are more stable and impacted by, of course, other and different issues. This is also related to the political circumstances in the country, with the emergence of a new political person, Eric Zemmour, was gaining lots of visibility, and there are lots of things happening on the right side of the political landscape, together with some, movements as well on the left side of the political landscape, and the president and the government, running all over this. So it's a very, dynamic political situation in the country right now, and if we ask people, which we did in another program, with Google Fracture Française, where we analyze lots of things about the French society and how it evolves year after year, we find, as we found in many programs around the world, that about the fear, about the concerns, that if we do not ask about the epidemic of COVID, we find the usual suspects in this country of the concern for people, the social issues, healthcare, retirement, pension funds, the public security, crime, and environment, and purchase power, which has, really, it moves ups and down. It's different according to the political preference, but they are the usual suspects which we measure. But of course, if we ask about the epidemic in the questions about what are your concerns, it always comes first. So we see that the fear of COVID still in the consideration sets remains the emergent concern. So we are not back to normal, even if we are not any longer this time in the middle of the epidemic. But I wanted to illustrate with these examples that there's been a strong, impact on the exercise of democracy with the election. That had been, of course, a very turbulent period during the epidemic, and that we are not quite back to normal, even if traditional concern in the French population now prevail. That's what I wanted to illustrate. And I know that Daryl will come back on this with the impact of the epidemic and the comparison with some countries.
Thank you very much, Henri. That's very, very helpful, not least because I guess at the same time that the epidemic is rolling out in France, much as it did in other parts of the world, there's all these other dynamics going on in the party system. It's much less settled than it is in other places. Daryl, you're in a position to kind of put this in a more global perspective as we zoom out a bit. I'll turn it over to you.
Thanks very much, Peter, and thanks, Henri. You set the agenda very well there. And a lot of what is going on in France, as Henri described, is what's happening in the world. We've now been through several elections involving COVID. So Ipsos has worked on about 15, actually elections in 15 different countries since the start of the pandemic, starting with South Korea at the very beginning of the pandemic, where we did a big exit poll. And there's some lessons that are emerging, some consistent lessons that are emerging. First of all, in terms of context, we are still in a pandemic. The public feels like it's still in a pandemic anywhere that you go. What you may be seeing with full football stadiums and restaurants being reopened and people going back out, people are doing this, but they're mindful that the circumstances have changed. Also along with that, it's changed the way that people look at things, for example, like political events and how they're evaluating government performance and political options. And it's also affected, as Henri correctly identified, the logistics of voting, which has an impact on the outcome, but also the logistics of campaigning and how you run a campaign during the course of a pandemic. Of course, we've been seeing electronic and mail-in balloting taking on a much larger role than we've seen typically. And it's had variable effects on turnout. The French regional elections, as Henri noted, and we also saw in the local elections, turnout was way down. But in the US presidential election, turnout was way up. And in fact, in Canada, where I was most recent election I was involved in, everyone was anticipating that we were going to have an historically low turnout, and we didn't. In fact, it was around the range of what we had back in 2011 and in that first decade of the aughts. It wasn't atypical. Elections of consequence still drive voters to the polls. If people are interested, they find a way to participate, and that's what we've been finding. While each campaign has been different, each has been affected by COVID, and there's no doubt. The issues agenda has narrowed. COVID performance is part of the discussion. There's a disproportionate focus on health issues and economics in elections, and the urgent has pushed out the important. So less focus on big existential issues, for example, like climate, and more focus on things like, for example, jobs and what I would call kitchen table economics, affordability issues. The other issues haven't disappeared, for example, like climate, but they're modified and given different priorities as a result of COVID. Ideology has been blunted. All parties and candidates in most of the elections, I would say all the elections we've been looking at, see a stronger role for the state than in normal times. So whether it's to provide business support, economic or personal support, personal economic support, both the left and right maybe have different versions of it, but both of them are talking about a larger role for the state than we'd see in normal election campaigns. External signals can have an effect on a campaign in ways that are different than what we normally see in elections. So what's happening with COVID globally or in adjacent jurisdictions can seep into the campaign. So people are looking at other places as to whether they're as a marker as to how your country should have been performing, or a marker as to how bad it could be if you weren't performing. This Build Back Better notion, and this should generate a few questions, sounds like great rhetoric, but for the public is basically seen in terms of a slogan rather than what it is really is being talked about. And what you find in the polling is that the specific policies of doing things better or changing things have a more positive impact than the overall slogan or approach. In fact, it seems celebratory at a time that people don't feel like celebrating. That it's an opportunity to do things better while people are in the middle of dealing what it is that we're supposed to be doing better from, if that makes any sense. It's too early. The anti-vax aspects of this gets a lot of attention. It drives media coverage, but it drives it more than it drives voting. Angry people make for good pictures, but governments that are already in trouble, it seems to make them look more embattled. But in terms of changing a lot of minds, not really. There's an extra burden on challengers in election and opponents in election campaigns compared to governments right now or incumbents. The public's already been through a lot of change, and it's difficult for them to ask the public to assume more. So the burden of proof seems to be higher on opposition parties than it is in normal election campaigns. The signs, as Henri was saying before in the current polling, is that the emotion related to COVID is flattening. It's less emotional than it was before, and people are learning to live with it, and they're not expecting things to return to completely normal anytime soon. But it's definitely not like it was at the peak of the pandemic, and the important issues, previously important issues, are starting to rise again in terms of their salience. And finally, in terms of political polling, one of the big concerns that we had at the start of this campaign was that it was going to make, or at the start of the pandemic, it was going to change everything about political polling. In fact, it really hasn't. The problems that political polls had before are the same problems today. There may be a few wrinkles that go along with COVID, but we aren't finding that it's leading to any more difficult outcomes in terms of our polling than we were experiencing prior to the campaign. We're just as successful as we were previously. And when we do have issues, they tend to be the same issues that we were experiencing prior to the pandemic. So Peter, back to you. Happy to take any questions.
Thanks very much, Daryl and Henri. And what I see there is there's a few things going on, but one is that you know that COVID continues to be an important issue and one that's front of mind for voters doesn't mean that voters are thinking about it in the same way now that they were at the start of 2020 or at the end of 2020. And the sets of things that it's making voters think about as they evaluate candidates and policies and parties is different now than it was at the start of the campaign. Then started the pandemic, excuse me, which has now been with us for some nearly 20 months. Vin, I think it'd be very helpful for you to, if you want to reflect on this kind of from an American perspective. I know you're sitting in Paris right now. You're a scholar of American politics, among other things, and I think we all watched the American election with a lot of attention. From what you've heard and what you've seen, do you think the American case is within the mainstream of how elections have unfolded in the time of COVID in other places, or does it stand out? And if it does stand out, why?
Thank you, Peter. I think that what we just heard actually I think helps put about France and about other countries' experience with COVID and during elections, helps underline the ways in which the experience, at least as I sort of saw it in the United States, the election that just occurred there in 2020 was so different. So, rather than COVID being what I think political scientists would often categorize as a valence issue, so an issue over which every party wants to say, we're tackling this problem, we have plans to tackle this problem, think about unemployment, creating jobs, healthcare. These are usually areas where plans might differ, but each candidate and party wants to say that they're attacking that issue. In the United States, though, what the interesting thing is that you essentially had a debate about whether or not COVID was a big deal and whether or not it was something that needed to be addressed by the state. that said, I mean, and that's what we basically saw, I think, unfold. I think part of that had to do, I don't think that would normally have been what we'd see happen in the United States. So I think part of that is that Donald Trump was a very particular candidate who chose to, I think, in a lot of ways, squander, a chance to basically make a case to the American people that this was a challenge that he was standing on top of, and as a result, I think that you basically had a very odd campaign. What's interesting, though, is that if you see how many American voters thought about COVID and approached it, as Daryl underlined, there actually was a good bit of support for the notion that the government should do things, spend money in particular, to help people deal with the economic fallout from COVID. And I think that that fact, in a lot of ways, upset the normal ideological alignment that you have, and not just in American politics, but broadly, but particularly in American politics, where you have a sort of right side of the spectrum that is much more free market approach in terms of responding to any problem, any sort of issue. And you basically saw voters basically saying, we want the state to write us checks and to basically help us make it through this pandemic. And on the one hand, you basically had sort of tacit acceptance of that from the Republican side, while also at the same time having an interesting debate about the state's role in enacting health measures like we're in the United States beforehand. And what's interesting here is that there's not a whole lot, at least as I see it, debate about whether or not there should be health measures, basically restrictions on, basically restrictions, normal restrictions like wearing masks and these sorts of things. Even the requirement to show that you have it's called the health pass here, le pass sanitaire, which either shows that you're vaccinated or have a negative COVID test. There are, every weekend here in Paris, there are protests about this. But I would say that it's a relatively small minority of people that feel this way. And for the most part, people, I think, feel safer by having these measures. In contrast, in the United States, I think even the idea of having a health pass is just a deeply divisive issue. And so, I'll sum up here by saying what I feel, one of the things that I think is sort of most interesting, Peter, it's something you said about the party systems, is that how political parties have chosen to deal with COVID, I think in a lot of ways in many other countries, looks like what you see when a crisis happens. Every mainstream political party wants to show that they're addressing this problem, that they have plans to address this problem. And it often kind of blunts, as Daryl said, the connection between ideology and voting. In the United States, though, I think you saw a completely different reaction, and one that was heavily constrained and dictated by partisanship and many Americans' strong attachments to either the Democratic or Republican Party in the United States, that in some ways made the debates, or at least the discussion around COVID, be less about sort of nitty-gritty policy details that you see in other countries and much more about these sort of identitarian issues. So that's my take and my reaction to what we've heard today, and I'm looking forward to the rest of the conversation.
Thanks very much, Vin. I want to just put a couple of observations on the table from my vantage point, and then I'll turn it into to a question. But one observation is that I think there was and we see this in Canadian data at the provincial level, but that there was a remarkably strong correlation early on between states taking strong actions and in fact suspending the rights and the liberties of citizens and constraining their movements and support for what governments were doing. At that time that Henri is describing that period of time in France when that first election was going on, we were in the field with a multi-country study with colleagues, and we were able to survey people before and after lockdowns. We found that where lockdowns were happening, people were more supportive of governments, more supportive of democracy, and supportive of those actions that were being taken. But in the Canadian case, at least, by the second lockdown, the one that happened, or the second lockdown that happened in the fall of 2020, at that point in time, citizens are still very concerned about COVID, but there was not a correlation between restrictive policy actions by governments and more support for government. It's as though citizens were tolerating the actions that governments were taking, but they weren't responding positively to them. And I think that, to me, is an important evolution in what's happened in kind of democratic consent for what governments have been doing, right? That citizens are becoming more and more skeptical of what governments are doing, but are still loaning them trust because they understand that COVID is important and is pressing. And the second one, and this is what I want to get, I want to turn into a question about institutional trust, which is also one of the questions in our Q&A. But it's that my sense is that governments have not been on the level with citizens about how long all of this would go on for. So I remember in March of 2020, at the end of March, being on a public panel, and saying, it's hard to imagine that this thing may go all the way to July of 2020, but it seems like it will, right? And that at that time seemed like a long. In Canada, we were being told we needed 2 weeks to crush the curve, right? And now we're on like week 80 or something, right? So we've been crushing the curve for a while, and so lockdowns were going to do it, and then vaccines were going to do it. But now it turns out, even when you're getting to 80% vaccines, vaccination, it's still the case that you need to have some restrictions on what people can do, and businesses are still constrained, and on and on and on. So what I wonder about, and I'd love to hear Daryl and Henri and Vin's view on this, is there a bite back coming for incumbents that essentially they've been telling citizens for all this time, look, we just need to do one more thing, when we're going to get through this. And in fact, now people may get to the point where they say, this is going to be with us for a while. And once they cotton on to the idea that this is endemic and it might be changing the way we live for a couple of years, I wonder if there's a backlash coming electorally, if not more broadly. Daryl, I'll turn it over to you on that question. I'd like to hear your views on it.
Thanks, Peter. Interesting observations from everybody, so thank you for those. There's a couple of things I'd like to point out in this, because we've gone through a transition. So one thing that Henri and I talk a lot about relative to this is there is no religion or political movement ever that has been created to shut down the world the way that science did. So what's really one of the interesting things here is that there's a real view that this whole process is being driven by science among the public. And you see a lot of politicians defer to scientists and medical professionals. But they're doing all this at a time in which scientists and medical professionals really aren't sure what's going on, really aren't sure what the facts are. This is developing in real time. But they seem to have a need to communicate a level of certainty about what they're saying that the facts don't necessarily, over the longer term, support. So the question in all of this, in terms of institutional trust for me, is how do you manage that type of an environment in which scientists have become communicators, but have to take on the worst habits of communicators, which is spinning, right? Or trying to make things look simplistic that aren't. I mean, or we would have kicked this if we all would have been washing our hands. Or, it wasn't, airborne, and air travel doesn't make a difference. And it's all going to be over when, the warm weather comes or whatever. So we've had to deal with all of these things on the way through, and it's left its mark, I think, in terms of on institutional credibility. And I think scientists are having a hard time figuring out what their role is in this and how to interact with the public most effectively. So I think that's going to be a question when we look back at this. We're going to spend a lot of time evaluating, because there's going to be some lessons for the future. In terms of the backlash that could potentially come for politicians, the thing that's really interesting in the data that we've been looking at, we have this tracking system that we call the disruption barometer, Peter, I know that you're familiar with. The disruption barometer took a real hit prior to the pandemic taking place. People were pretty uncertain about where the world was going. That hasn't disappeared. The pandemic has taken a disproportionate place in terms of people evaluating how their lives are going. But as the pandemic comes out of the calculation, we're seeing those problems that existed before about economic inequality, lack of certainty about the future, a whole series of things that are very personal in terms of people feel about how their lives are going. We're starting to see those things reemerge. And I don't know that it's so much the pandemic that could potentially drive a political backlash. It's the fact that those issues are reemerging and people still haven't heard great answers on them from their politicians.
Henri?
Yeah, I wanted to say a few things about this because in general terms, when we look at I would say the support, the confidence in the different institutions, whether it's the government, the members of parliament, the Lord mayors, the scientists, police, army, we find levels in general which are, not disconnected to what we experienced 1 year or 2 years ago. We see some little moves, but there is nowhere a sharp decline, for instance, in one of these categories. And I think the point is that it's very important because Daryl spoke about the scientific personnel. You need to go to the individual level of a given institution, of a given category of scientists, for instance. The fact is we also live in this world of social media, where there is very quickly an attention on what you say or what you write, and there are some interactions for one given specialist or one given institution. So we should not consider that just looking at the average of a category is the relevant measure, but also dig a little more into the specifics. If we talk about the scientists, for instance, there is an example which struck me and which struck many of us because many of us work with data and statistics, is how the data have been the lost child in all this adventure. The definition of the data, the way to measure, people victims of COVID, for instance, the definition of the categories of hospitalization, etc. It has been a very difficult landscape to just get qualified data to start with. But interestingly, on some media, we saw lots of scientists speaking actually about things they had no idea about. So we saw a certain number of doctors who are extremely qualified about treating one individual and being able to explain, for instance, what is the link between being overweight and very detrimental reactions to the COVID. So doctors were set to speak about an individual case, but we are talking about epidemic, which is a collective, analysis of epidemiologies about populations and not about individuals, populations of vegetals, population of animals, population of humans. And suddenly you could hear a certain number of very wrong statements about models, about statistics, etc. So I think, for instance, the usage of models, sometimes models have been overused to say, oh, if we don't do this now, in 10 weeks' time, you will have this or you will have that, which no modeler would ever say that, because the modelers who are doing these calculations knew perfectly well that there are so many parameters and so many changing parameters that it's very difficult to go beyond a certain number, a small number of weeks, for instance. But in return, there was the idea of, we will see what happens in 1 week. But if what happens in 1 week is actually much easier to predict than what happens in 12 weeks. And there's been a long list, I think, for researchers in the future. The perception of this scientific debate will be a very rich field for research and for students, because it has happened. So I think we should go beyond the category. And I think it's important, if we talk about the confidence, that we be more specific, that we are more specific in terms of this institution or this laboratory or this media, etc. Because I think this crisis, in more general terms, has been, from my perspective, an amplifier of dispersion. So we may see things in average the same, but in some areas, it's more dispersed. And actually, Kevin mentioned a certain number of things about the US society and the US politics. And we saw over time, and actually it was published a certain number of papers on this, that you had a widening gap on some items between those for or those against, between the Democrats and the Republicans. But we also have this in terms of income, in terms of status. So the average remains, of course, interesting in terms of support and credibility and confidence. But it's really a good time to go more into the specifics, because lots of things happen which are actually specific and very characterizing of the situation.
I mean, I think that's very good. And I want to talk about states that look different than the average in just a minute. On the issue of expertise, I might just add the following observation, that there's a bit of a complicity here between politicians and experts, right? Because for a politician to defer to experts about whether we should lock down or not is for them to say, I'm not responsible for the costs of what I'm asking people to do, and nor am I responsible for whether the thing I'm letting this person recommend to you, I'm not responsible if it doesn't work or not, right? Whereas there's a model where, and this is actually much more the British case than the Canadian one, and the Brits have not covered themselves in glory through COVID, but the scientific advisory model in Britain really puts the facts on the table and lets the ministers decide about what should be done as a result of that. It's not a full-on deference. So that's one bit of it. And the second is that, there is the following challenge. I've followed the vaccine case very closely in Canada, for example, and we have several bodies advising on vaccines. And among them, NACI, the National Advisory Council on Immunization, decided to share its views on the AstraZeneca vaccine in February and March of 2021. And they drove the number of people, if you ask people in a properly conducted survey, whether they would take the AstraZeneca vaccine if offered, at the start of that period in time, between 80 and 85% of them would. At the end of that period in time, only 60% of them would take AstraZeneca if offered. This is the vaccine that will save the world. And we had something like 25 points of Canadians saying, no, thank you, I don't want that vaccine now. Who were those people? People who had greater trust in scientists, people who thought COVID was more concerned, people who were vaccine willing, taken together, people who trust the science. And it's a story there of in some sense, mediated and unmediated communication, the goal of getting everyone vaccinated. And I think that's partially related to the idea that our experts weren't constrained by politicians, who, after all, have a different set of obligations than everyone else in terms of how they communicate and in kind of marshaling all of our efforts towards some goal. Vin, I want to let you get in here, but I just want to throw it to Daryl for a second to ask him, are there any countries you're seeing that are different than the average, where incumbents, have been able to marshal this greater trust and greater temporary belief in the capacity of government to be doing bigger things? Or are we sort of reverting to a mean where there's just, lower levels of institutional trust and where no one's actually converting, the crisis of COVID into a different type of politics?
That's an interesting question, and it will be one that will become clearer over time as we're able to look back. The answer will become clearer over time as we're able to look back over more trend data. But the thing that's striking to me is how the assumption might be that all countries are the same, and then when they're affected by something like this, that they will all change in a similar way, and that's not what happens. So in countries in which, for example, state trust is low, trust in everything that was related to what was happening with vaccines and everything else was low. Country, for example, like Russia. France was disproportionately low in terms of institutional trust in comparison to places like Australia or Canada, in fact. Japan had institutional trust issues. So it really, what it did was it amplified the situation that already existed, and you could see it in the way that people answered questions. So if they were in a country that was just naturally distrustful of certain, say, for example, political institutions, anything that related to COVID, they would be lower than the global average in terms of how they would respond to things like, for example, institutional trust. So we didn't all start off in the same place. COVID hit us, and it's not just in terms of timing, but it hit us in terms of where our minds were in different ways, where our minds were towards institutions and to governments and to, the issues agenda and all the rest of it. So it had a disproportionate amplifying effect more than it had I would say, a changing effect, if that makes any sense.
Vin, I want to turn it over to you.
Sure, thanks. This is a great question, and my take on it is that whether or not there'll be a backlash is, I think largely what we see, we saw in the U.S. elections, we saw in the New Zealand elections just before that there are enough people that are willing to reward and punish incumbents for how well they take care of how well they take care of COVID, but how well they take care of anything. But for me, I think one of the bigger deciding factors here is the degree to which people are willing to basically make attributions to government and to institutions for basically being responsible for this. And I think what Daryl said is exactly right. If you're in a low trust society, a society where people don't trust institutions, then they're not all that surprised when they don't do that well. And the point I'll leave on is really more of an opinion or sort of an editorialization of this, which is that I think many governments missed a chance actually to potentially build trust by doing exactly the opposite of what you sort of pointed out, Peter. Rather than saying, the cure is around the corner, just give us a couple of weeks, which of course, even in the middle of March 2020, when we were very uncertain, I think many scientists were saying, I think it's going to take more than 2 weeks. I think that was a time that incumbents and governments could have said, we're going to have to do some very hard things, almost a sort of wartime mentality, right? We're going to have to do some very hard things. We're going to have to come together, and I'm going to level with you as long as you show us some patience. But I think, I think some governments did do that, Denmark, New Zealand, but I think many others did not. And unfortunately, I think that we see that they have not benefited from the increase in trust that you might have expected a crisis would have engendered.
Henri.
Yeah, I wanted to come back to what you said about the relationship between the scientific boards or institutions and the political decision makers on one side, and the distinction between the scientific specialization on the other side. The fact is, whether scientists do a good or excellent job or have uncertainties, in the end, the decisions remain the decision of the political authorities. So in that sense, because the topic is about democracy, I don't think we truly saw a change in the power engine. It remains the political institutions and the leaders, and not the scientists. I mean, there is no situation where the scientists would have run the show. I think there have been different expressions about this, but de facto, in reality, scientists and advisors remain advisors, period. I think that's one of the lessons of the story, and we can look back about this. I think it's also an area for potentially some research, but I think from my perspective, I think it remains clear. The point I made earlier is about the fact that scientists are not all equal. There is a bit what you have in some circumstances on media or debates is that because you are a scientist of something, you can speak about anything. And I think that has been a real pitfall in this time. That it's not the same. When you work in a scientific laboratory, you say, for this question, we should go with this one in the lab because he or she is very knowledgeable about this topic. And this is how scientists do work. I mean, you really know very well something, but you know that for another field, you know what you don't know. And what was really striking is that there has been a massive development of people who had views and comment on the epidemic. And epidemiology is a very specialized field where you can of course make mistakes, but it's not the same thing to be a kidney doctor or a brain doctor, a neurologist, and suddenly to speak openly about the epidemic. And actually, people with statistical background sometimes were much better off speaking about the epidemic and the measurement at the right place, because of course, models have their limitations as well. And actually the modelers were very careful with their models when you look at their own literature. So I think for a certain number of reasons, a certain number of people were not ready to step up in front of the media and were very, very strongly exposed to a point which added to the confusion. So I think one of the lessons is also that when you are in such a crisis, you need to gather the right specialists, but use them for what they are good at, and they should not let themselves be stretched about talking about things they don't really know so well. And that added to the confusion, in my view.
Yeah, I think that's very fair, Henri. I mean, in my view, and I'm going to ask us to look forward in just a second, but in my view, one of the challenges is you have too many people working outside of their lane, as people would say, or speaking on things which they don't know, but also too many people thinking there's an answer in a single field, right? And the capacity of our political class to take data and insights from multiple different approaches and put them together is in large part, I think, where there were major difficulties. So, I mean, how many of us would have known how much work was going to change over a six month period if you lock it down and don't let people take public transit and ask them to work from home? Epidemiologists have nothing to say about that. Sociologists have something to say about it. Labor economists have something to say about it. People in technology have something to say about it. But seeing the whole picture required drawing from more resources than I think our political classes are used to drawing from simultaneously. And I mean, this was a life-changing event, right? Or series of events. So we can't fault them for that. But I think that it's at once this desire for expertise that's very precise, but also the need to be able to draw from multiple perspectives kind of at one time that really amplified the difficulty of this, and actually, frankly, continues to amplify the difficulties of it. I want to ask us just to look forward. So we've got 3 minutes left. Daryl, Vin, and Henri, what are you looking for, and what interests you about the unfolding of COVID and democratic politics over the next 6 months, over the next 12 months, and maybe even longer? Daryl, I'll go to you first.
Well, I think that this is one of those issues that tends to track the calendar. So now that we're coming up to the second anniversary in March of next year, people are going to start asking a lot of questions. 2 years is a long time to have had your life altered the way that it's been altered. I think after a year, the character of what people were thinking had changed. And I think after 2 years, we're going to see a kind of a different type of public reaction. So I'm going to be looking at what happens through the course of the summing up of 2021 and the kind of position that leaves people, the kind of mentality that leaves people going through as we get into 2022. And I think that that's going to be an interesting a flex point as when we go through the holidays at the end of this year to see how people are going to be regarding the next year.
Thank you very much. Vin.
Yeah, I'm curious to see actually, if what we see is that vaccinations rates work and the pandemic begins to ease. I don't think it's going to disappear or anything like that. I think that I think it'll be interesting to see one, how people have already modified their life in many ways, how they work, how they live, how they interact with others. And it's going to be interesting to see how that gets pulled into the sort of political debates that we normally see. And one of the things I'm particularly curious about as we move forward over the next year or so is the degree to which we're actually going to see sort of a widening differences between wealthier countries that can afford vaccines, that can basically afford to restructure their economies, allow people to work from home and all this sort of stuff, and poorer countries where that's not the case. And I think that we might be seeing ourselves talking about the problems that those inequalities are going to create in the long run.
Henri.
Yeah, I think we have seen a wide dispersion in situations, and to Vin's point, we are now in Western countries in situations where we are using the third dose of vaccine. and with a vast part of the world, which has not started for most of the population, even the first one. So that's an international gap, but we see also some gap inside the different countries. So there is, of course, I think the perception that lots of things have changed, because there are some effects which probably will last in terms of the way, for instance, to order food, to get home delivery, for instance. We see a certain number of habits which have been taken by people and which probably will remain. But in return, as I said earlier, we see that some underlying issues in the societies, the concern for the future, the social issues, the healthcare, the public security, the environment, which has also gained some momentum, even if it had some variations, are there to remain. And I think in the end, after all this debate about exercise of democracy, and you talk about the question of confidence and trust, I believe that the authenticity of the message and of the institution will be increasingly important. Everything is checked and double checked. Everything, can be analyzed in the social media by some experts, etc. So making it authentic, genuine, will be increasingly important, and not only truth well told, but real truth and really well told.
Thank you very much. I think those are all things that we want to look out for. I want to wrap all that up by saying that one thing that Ipsos does measure regularly is what worries the world, or what worries people in different countries. We are meeting again with other experts from Munk and Sciences Po Cevipof on November 22nd, and we'll dig into data on what worries the world. And Daryl will be rejoining us then, and perhaps Henri. But for now, this has been, I think, a very interesting, from my perspective as a person who spent the last 2 years nearly obsessed with understanding what people are thinking about COVID. I think this has been very useful for me, and I hope for all of you who've joined us, in giving us a sense of globally what's going on. And I think that this is one of those moments, doesn't happen very often, where the whole world is going through, the whole democratic world at least, is going through the same things in some of the same ways, and how that reorders our politics and spills over from one jurisdiction to another, I think, to me, is the thing to watch out for over the next 12 to 18 months. I want to thank Daryl and Vin and Henri for joining us, for giving us your time and your insights, and to all of you who've joined and gave us your questions and your time and your attention. We really appreciate it here. So I'll just say on behalf of Ipsos and Cevipof, and certainly the Munk School of Global Affairs and Public Policy, that thank all of you for coming, and we look forward to you joining us on November 22nd to dig into what worries the world. Thanks very much.
Thank you.